Welcome to Pharmative Live. I'm Dr. James Partyka, your host, and we're coming to you live from Palm Springs, California. Pharmative.com and Pharmative Live is all about connecting people and patients to healthcare professionals and scientists in order to educate ourselves so that you and your family can make informed decisions with your healthcare professionals regarding medication management for you and your loved ones. That's Pharmative, and this is Pharmative Live. Pharmative Live is sponsored by our sister company, Pride Nation Radio at PNN.FM, which is the number one LGBTQ dance music station in the nation. Pharmative Live and Pride Nation Radio are operated under the umbrella of PNN Media Group in Palm Springs, California. And you can just enter PNN.FM into your web browser or download our PNN One Plus Help mobile app. And not only is it great music to dance to, but it's great music to work out to as well. So do that today. Today's topic, we're going to be talking about one of the oldest medications that have been available for relief of pain, inflammation, and fever, and that's aspirin. Aspirin has been used as a medicinal agent for over 2,400 years, and it was used by extraction from leaves from the willow tree. And then scientists and pharmacists formulated the extraction from the leaves into what we now call aspirin, and the generic name is acetylsalicylic acid. And that's the one generic name I would like you to always remember, because salicylates are oftentimes in a number of medications that are available over the counter. And we're going to talk about that in more detail later on. So let's get started, and please feel free to text your questions. You can always send your questions or comments to me at info@pharmative.com. Okay, believe it or not, over 120 billion pills of aspirin are consumed worldwide each year. I think that's an outstanding number. There are a number of advantages. It's very effective at relieving fever, pain, and inflammation, reducing inflammation. And it's used for a number of systemic inflammatory diseases like Kawasaki disease, rheumatoid arthritis, autoimmune disorders, and so forth. And it's one of the least expensive medicines available to you over the counter, especially if you buy the generic formulation. Now remember, the generic formulation, manufactured by many manufacturers around the world, has been determined by the FDA to be bioequivalent to the brand names of aspirin. Okay, so when you have a choice in your pharmacy or at your local store in your neighborhood, I oftentimes recommend to use the generic formulation, which is located right next to the brand name. Kind of disregard all the flashy, colorful brand labels, and just buy the generic formulation. Unless there's a specific reason that you prefer a particular dosage form, and it comes in a number of different dosage forms: chewable, capsules, tablets, suppositories, and then there are different formulations with enteric coating to prevent you from having an upset stomach, and to prevent that irritation in the stomach lining. And then there are slow release formulations of aspirin also available. Most people who use aspirin occasionally, like say for example for back pain or joint pain or for a headache or to reduce fever, just use a few tablets occasionally, and it doesn't really matter too much whether or not you choose a sophisticated, more pharmaceutically elegant formulation versus just purchasing the generic formulation. So I recommend the generic for most patients, but when in doubt, ask your pharmacist or ask your prescriber about what would be the best formulation for you based upon your specific needs. For example, if you have trouble swallowing tablets and capsules, there may be a better way that you can take the medicine for you. So buy the generic when it's available for you and your family, and when in doubt, ask your pharmacist. So aspirin falls under the category of non-steroidal anti-inflammatory drugs, NSAIDs, and you'll hear that term used quite often in the scientific literature, but also in the lay press, lay literature, things that you're reading. A lot of times, doctors and nurses and pharmacists will refer to aspirin and patients as an NSAID, and that stands for non-steroidal anti-inflammatory drugs. But aspirin is unique because, as I stated earlier, the generic name acetylsalicylic acid, the chemical name, that acetyl group acetylates platelets and basically disrupts platelet function, and therefore aspirin can reduce your risks of developing new clots, and it can also be used for cardiovascular disease, and we're going to go in more detail in that later on. And that's very uniquely different than all of the other NSAIDs that are commonly used, such as ibuprofen, naproxen, and there are many others available either over the counter or by prescription. Okay, so aspirin is uniquely different from all of the other NSAIDs because of that acetyl group on the chemical structure of salicylic acid. Okay. Recently, there have been some new guidelines for using low-dose aspirin to prevent the risk of developing a heart attack or stroke. And the guidelines I've posted for you that are summarized by the Mayo Clinic on the Pharmative business page for your reading and review. Anyone that embarks on going on low-dose aspirin therapy on a long-term basis to prevent a heart attack or stroke really need to do it under the supervision of your physician or cardiologist, okay? As you age, your risk of developing a heart attack or stroke increases, but also as you age, your risk of developing bleeding from aspirin therapy increases. And as we've talked about during our Pharmative sessions, we're always weighing the benefit versus the risk of taking any medication. So you have to understand what is the clear benefit, and in this case it would be reducing pain, reducing inflammation, reducing fever, and what are the risks. And one of the well-known established serious risks of using aspirin at any dose is developing bleeding, because acetylsalicylic acid irritates the stomach lining, can irritate it to cause bleeding, ulcers, and so forth. So we always have to weigh the benefit versus the risk. So these new cardiovascular guidelines, again, for people that are at high risk of developing a heart attack or stroke, or patients that have undergone coronary artery bypass grafts, or have stents, initiate on low-dose aspirin therapy, 81 milligrams daily, is a commonly prescribed dosage. And those are for patients that are at high risk. And one of the ways when you take aspirin to decrease the risk of cardiovascular complications is to use a cardiovascular risk calculator, which is available online. And I've posted that also for you on the Pharmative business page. And you basically enter your age, your cholesterol, your lipid panel, and it'll give you a number which will give you an estimate of what your risk of developing a cardiovascular event is in 10 years. So if the number comes out 10, you have a 10% chance within 10 years of developing a cardiovascular event such as a myocardial infarction, heart attack, or stroke. So with your cardiologist or physician, again, there are many people that are at risk to developing heart attacks, and that has a lot to do with whether or not you have hypertension, diabetes, whether or not you've had a prior heart attack, whether you smoke or not, and all of that can be taken into account whether you're a candidate for low-dose aspirin on a continuous long-term basis. And again, the risk is developing toxicities from aspirin, and the one toxicity of most concern is bleeding. So anyone that is thinking of initiating low-dose aspirin therapy really needs to discuss that with their physician or cardiologist. All right. Ask them if you can calculate your cardiovascular risk using the calculator. And again, I've posted that for you on the Pharmative business page as well. And then make that decision accordingly. There's primary prevention of using low-dose aspirin, which is you've never had a heart attack or stroke, but you're of a certain age and you fall in a certain risk category, and you want to prevent ever having a heart attack or stroke. That's called primary prevention. That's a little bit more controversial, whether or not you should start or initiate aspirin therapy. And then there's secondary prevention for those people that have already had a heart attack or stroke, and depending upon your age and what is calculated for you in that cardiovascular risk calculator, you can then determine or not whether you should initiate low-dose aspirin at 81 milligrams a day or not, because there is a risk of developing GI bleeds. So again, that's one of the common uses of aspirin. I've already stated the other 3 common uses of aspirin using the standard dosage, which is located right on the package. And anytime you initiate any kind of new medication, whether it's for short-term use, occasional use, or long-term use, anytime you start a new medication, I just want to recognize Jimmy and Helen and Steve out there. Welcome to Pharmative Live. And we're coming to you live from Palm Springs, California. You want to clearly understand the directions, okay? Whether that's by reading the package and what the active ingredients are, or whether that's the directions your prescriber or your pharmacist have given you, okay? It's important to understand because medication can be tremendously beneficial for different reasons when you initiate therapy, but it also, all medications do have side effects. So you really have to understand the appropriate dose, how to take the medicine, and what other medicines you should not take with it, oftentimes referred to as drug interactions. And unfortunately, aspirin has a lot of drug interactions. For example, aspirin with certain types of antidepressants can increase your risk of bleeding tremendously, especially the antidepressants under the category of SSRIs. Common names are Prozac, Zoloft, Lexapro, Paxil. You really shouldn't take aspirin. And there are many other alternatives available to you, either over the counter or by prescription, that you wouldn't necessarily need to take aspirin. You could take something like ibuprofen or something like generic Tylenol, acetaminophen, as an alternative, or another drug, NSAID, which is naproxen. So acetylsalicylic acid, aspirin, is very unique in that it acetylates platelets, alters platelet functions, and decreases the risk of you developing clots, but that also comes at the cost of increasing your risk of developing bleeding. So it's commonly prescribed, commonly used, effective medicine, but there are many more modern medicines out there that you might want to choose, like ibuprofen or naproxen, that might not have those kinds of complications or drug interactions associated with it. So I'm one of these people that kind of, for myself, having joint pain or headache, I or back pain, I might lean towards more like ibuprofen and taking ibuprofen with food to avoid GI upset, stomach upset, as opposed to choosing aspirin. And again, when in doubt, ask your prescriber, ask your pharmacist, get to know your pharmacist. They've gone to school for over 6 to 10 years of college. They specialize in various different types of medicines, and they truly are the medication experts and can answer your questions. Another great resource on the internet is drugs.com by the FDA, which has all of the medications that are available in the United States. And it also has a drug interaction checker, which we've talked about before on this web show. And you enter your medications into the drug interaction checker, and you're looking for moderate to severe drug interactions. And you want to discuss that with your prescriber or your pharmacist and ask them how you can manage that. Sometimes there's an alternative medicine. Sometimes it's about altering your diet. Sometimes it's about the time of the day that you take your medicine, and so forth. So many ways of which we can do to either reduce the likelihood of a drug interaction or avoid it altogether. Now, when talking about aspirin, I just want to also talk to you about some of the warnings of aspirin. Okay, so you do not use aspirin if you have a bleeding disorder such as hemophilia, stomach or intestinal bleeding, because of the platelet dysfunction that aspirin causes. So you do not use aspirin. Children, we do not use aspirin in children because of the risk of developing Reyes syndrome. Now, what is Reyes syndrome? Reyes syndrome is an inflammation of the brain and also leads to liver damage, and in some cases can be fatal. Now, Reyes syndrome is rare. It's approximately 1,000 cases or less in the United States each year. But we just recommend don't use aspirin or salicylates in children just to avoid, because viral infections, metabolic disorders in combination with salicylates, such as aspirin, increases your risk of developing Reyes syndrome. And what are the symptoms of Reyes syndrome? I have them right here. And diarrhea, rapid breathing, vomiting, fatigue, which can lead to more serious complications such as confusion, seizure, loss of consciousness. So again, if anyone is developing those kinds of symptoms while on salicylates, while on aspirin therapy, right, call your doctor. If the symptoms are severe, go and call for a paramedic, go to the emergency room, because Reyes syndrome can be managed in a hospital with supportive therapy, okay? So again, do not use aspirin in children and do not use salicylates in children. Now, there are many commonly used medications over the counter that have salicylates, and you may not even know it. And that's why I'm saying you need to, when you think of aspirin, think of ASA, acetyl salicylic acid. And a factoid is that acetyl or acetic acid is vinegar. And so when you open a bottle of aspirin, if you take a whiff of it, you'll smell a little bit of vinegar. And that's because water catalyzes the breakdown of aspirin into vinegar and salicylic acid. If the odor of the aspirin bottle is very strong, look at the expiration date, because it may mean that the medication is too old to use it. Again, you should always use medication within the expiration date that's on the package or on the bottle. So again, drugs like Pepto-Bismol have salicylates, so we don't give Pepto-Bismol to children. And I have a list of there are many products available over the counter that have salicylates: Alka-Seltzer, Excedrin, Kaopectate, Pamprin. Many of the Bayer products have aspirin, Ecotrin, Lortab, Soma, Percodan. So again, look at the label, Know what you're consuming, know what you're taking. Children should avoid salicylates altogether because of the risks of Reyes syndrome, which can be fatal. All right, and when you take any medicine for the first time, clearly read the directions or ask your pharmacist, ask your prescriber. Make sure you're taking it appropriately. Oftentimes, when I take aspirin, I take it with food. I oftentimes don't even use aspirin at all anymore because of the risk of bleeding. Even though I tolerate it fairly well, I just feel like ibuprofen works just as well for me. And what I also have found, and I've had patients tell me this, for migraines, Excedrin, which is a combination of aspirin, acetaminophen, and caffeine, works extremely well. But remember, Excedrin, and again, contains aspirin, salicylates. So just be aware of that. And certainly you don't want to take too many products that contain salicylates because high doses of aspirin salicylates can cause toxicities, which needs to be managed by a doctor, oftentimes in the clinic or in a hospital. And certainly if someone accidentally took way too much aspirin, call your poison hotline for instructions immediately. Okay. Some people really require high doses of aspirin for long periods of time because of their inflammatory disease like rheumatoid arthritis or because of an autoimmune disorder, and they need to be monitored carefully as well for toxicities associated with aspirin usage. All right. I'm just making sure, looking at all of my notes. So just to summarize, aspirin commonly prescribed, commonly used, inexpensive agent, highly effective for reducing pain, fever, and inflammation, for minimizing the risk of developing a heart attack or stroke. Low-dose aspirin therapy, 81 milligrams a day, may be recommended, but that's based upon the advice of your prescriber, your physician, your cardiologist. Patients that have undergone coronary artery bypass grafting or stents are oftentimes placed on low-dose aspirin. And remember, we do not use aspirin with other blood thinners. Blood thinners like warfarin, the brand name is Coumadin, or the other medicine, there are other medicines that are anticoagulants as well. So do not use aspirin with other prescription anticoagulants. And when in doubt, ask your pharmacist, ask your prescriber. And remember this, with any medicine, especially at higher doses and the longer you use them, you can develop long-term complications. And with aspirin, you can develop long-term complications such as kidney or renal insufficiency, and even hypertension. If your hypertension is well controlled on antihypertensive medicines, you can occasionally use aspirin. Again, there are other alternative, better choices out there, such as ibuprofen and naproxen, and there are prescription medications available to you. And when pain is persisting for long periods of time or fever persisting for 3 days or more, one needs to see a clinician, a physician, to see what's going on with you. Again, so that's all I have to say. Aspirin's a great drug, but only when used by its directions, for its approved indications. It has a lot of toxicities associated with it. I can go through the whole list. The most common ones are the bleeding that can result because of the platelet dysfunction that aspirin causes, the drug interactions, irritation of the GI lining, stomach ulcers, and long-term use, it can affect your blood pressure, and it can also cause kidney disease. So you only want to use an NSAID, and that's true. NSAIDs also in general cause kidney disease, kidney insufficiency. So you want to only take medicine when there's a clear benefit, and for the short, lower doses, as needed, and again, be monitored closely by your prescriber or by your pharmacist when you use any medication. That's it for today. In the meantime, until I see you next time, stay healthy, as it's easier to prevent disease than to treat disease. I'll see you next time.